The treatment of heart failure with reduced ejection fraction has evolved in leaps and bounds over the past decade. In the past, doctors relied on drugs that aimed to improve the contractility of the heart muscle, such as digoxin. They then later improved the outcomes of patients with heart failure by introducing drugs that decrease the resistance in the arteries in the distal extremities. These drugs included drugs such as ACE inhibitors, an isosorbide dinitrate combined with hydralazine. Today, doctors target neurohormonal systems that are activated as compensatory mechanisms in heart failure. These include the RAAS, or renin-angiotensin-aldosterone system, and more recently, the nitric oxide cGMP PKG system. As a result, the standard treatment of heart failure today includes the use of the foundational quadruple therapy of ARNIs, ACE inhibitors, and ARBs that work on the RAAS system, beta blockers that block the sympathetic nervous system, drugs that block the aldosterone in the body called mineralocorticoid receptor antagonists, and SGLT2 inhibitors that help the kidney to excrete salt. Heart failure with reduced ejection fraction occurs when the heart is unable to supply enough oxygenated blood to the tissues due to an inability to pump blood into the circulation. As a result, the body reacts by holding on to more fluid to help increase the amount of blood in the body to improve delivery. This, however, eventually fails as fluid leaks into the lung tissue and collects in the legs and in the abdomen. At the same time, our bodies increase the contractility of the heart muscle and the rate at which the heart pumps. Eventually, this also fails, leading to stretching of the heart muscle and remodeling and replacement of the heart muscle by fibrous tissue in a process called fibrosis. As this process progresses, the sympathetic nervous system is activated, causing the vessels in the extremities to narrow or to constrict. This in turn increases the work the heart has to do to supply the tissues with blood. Enter a new class of drug called a soluble guanylate cyclase stimulator. Soluble guanylate cyclase is an enzyme that works to convert guanosine triphosphate to cyclic guanosine monophosphate, which promotes blood vessels relaxation and counters harmful remodeling and fibrosis of the heart muscle. cGMP, or cyclic guanosine monophosphate, acts on the enzyme called PKG, or protein kinase G, to reduce calcium signaling in the smooth muscle cells lining our blood vessels and in the heart. Reduced calcium signaling in the blood vessels and in the heart muscle causes them to relax. As a result, the heart faces less resistance, fills with blood more easily, and can pump blood easier to the tissues. Vericiguat is a drug that stimulates the system. It stimulates SGC, or soluble guanylate cyclase, to produce more NO-cGMP, and this drives the reaction forward. It is considered an add-on drug to the four foundational drugs mentioned above for patients with recently worsening heart failure, such as those requiring hospitalizations or IV diuretics. In fact, the drug vericiguat reduced the combined risk of cardiovascular death or heart failure hospitalizations in people with symptomatic chronic heart failure and ejection fractions lower than 45%. Most of this benefit came from reduced hospitalizations. Because of drugs such as vericiguat, the prognosis of patients with heart failure with reduced ejection fraction has improved significantly in recent times. How much further doctors can take the treatment and well-being of patients with heart failure with reduced ejection fraction is anybody's guess at this time. I hope you enjoyed the video. If you did, like and share the video with your friends and family. You can support this channel by subscribing. Until the next video, stay healthy and stay safe.